Some people look young until they have to stand up. You probably know someone like this. They look great on the outside. No wrinkles, no gray hair, they're a normal weight. They look 45. But the moment they stand up and try to move, it's obvious something is different. They're slow, they're stiff, they get winded easy. They move like they're much older than they actually are. What's going on here? Most of us think about aging in one way. Wrinkles, gray hair, weight gain. We think about aesthetics, but there is another kind of engineering happening underneath all that. It shows off in your move, how you recover, how you handle stairs, how you pick things up. It shows off in your physical function, and that's actually what matters most. Here's what happened. Starting at age 30, most people start losing muscle. Slowly, year after year. A little bit here, a little bit there. The medical term is sarcopenia, which just means gradual muscle loss as you get older. Most people don't notice it at first because it is low. But over time, if you don't do nothing about it, you can end up losing strength, muscle, and function. You're slower, you fatigue easier, and suddenly, things that used to be normal, walking, climbing stairs, getting off the floor, becomes more difficult. That's the disconnect. Someone can look young on the outside and still be losing strength and muscle over time. Now, I want to be clear about something. When I say muscle, I'm not just talking about looking big or looking fit. Muscle does a lot of things. First, it's what gives you strength and movement. Obviously, if you have less muscle, you have less strength. You can move as well. Second, muscle helps with balance and reaction time. Your muscles are what catch you when you stumble. They're allowed to react quickly. As you get older, that matters more. Third, and this is important, muscle is a metabolic tissue. It helps your body handle glucose better. When you have a healthy muscle, your body can handle blood sugar more efficiently. When you lose muscle, that becomes harder. And fourth, muscle supports your physical reserve. That's your ability to handle stress on your body, recover from hard days, and stay functional over time. When you have muscle, your body can handle more. You stay independent longer. And all that matters more than fitting into your old gyms. Here is where most people get it wrong. They think about training one way, to look better, to see muscles on the mirror, to fit into smaller clothes. And that's fine. There is nothing wrong with that. But you should also be training for something else. You should be training for the next 40 years. You should be training so that at 60, 65, 70, 75, you still move. You can still be independent. You can still do the things that you want to do. Those are two different goals. And you can do both. So what should you do about it? It's actually pretty simple. Nothing crazy. You need resistant training. It doesn't mean you have to become a bodybuilder, but your muscles need a signal. They need a reason to stick around. That could be weights. It could be resistant bands. It could be body weight. The point is, you're signaling your body that you need that muscle, so your body keeps it. You need enough protein with your meals. Your body needs building blocks to maintain muscle. Protein gives you that. You need daily movement. Just walking. Just moving around. Your body was built to move. You need good sleep and recovery. That's when your body actually repairs itself and adapts. And you need to do it consistently. Not perfect, consistently. Look, aging is real. You can't stop it. But you can change how you age. You can decide, am I going to maintain my physical function as I get older, or I'm going to let it slip? Most people do think about that until year has passed. By then, it's hard to build back strength. So here's what I want you to take away. Muscle supports how you move, how you recover, and how independent you stay over time. It is not just vanity. Train for the mirror if you want, but train for the next 40 years. And one more thing. Everything I just said is educational. It is not medical advice. It is not personalized to you. If you have a specific health condition, talk to your doctor first. But in general, this is why some people look young but move old. And this is what you can do about it.